Are you in helping somebody figure out what's wrong with their pelvic floor issues? And I ask that question not to professionals, but to the average person. And where this question came from is just spending time in more patient-focused Facebook groups, chat groups, that sort of thing. It's so different than it was even just like 5-10 years ago. Like, we literally had to argue to fight years ago to have first line of conservative care to be a pelvic floor PT, and people never heard of it. Helping people find a PT in their area, Now it's more, if they are finding a PT, it's finding somebody that is a good fit for them or understands their particular issue, if they're like getting back to a certain sport or a particular diagnosis or something. But what I'm seeing a lot of, in addition to, have you seen a pelvic floor PT yet? And these are not just like pelvic floor specific Facebook groups and things like that. These are just general, I would say a lot of them are like active mom groups, running groups, that sort of thing, is a lot of people being very generous with their stories and their advice. And it's great. I think, again, the more that people hear that somebody else is going through something similar to them, I think it makes us feel not so alone. I think it makes us feel like we're heard and acknowledged, especially if you're having difficulties finding a provider that understands. Here's the downfall. And this is something that I'm very conscious with myself, having navigated prolapse issues, leakage issues, diastasis recti issues, like pelvic girdle pain, like all of the things, that my story is just mine. And it's hard when I have a patient that sounds just like me, not to start with that. And fortunately, obviously, I have a lot of other things to fall back on. I will wait. And if it's the appropriate situation, I will share my personal story. That's with an in-person session. Obviously here, I'm pretty open with whatever, because you guys can listen or not. But I think it's incredibly important to understand that although our own personal stories are valuable, it is just a small little microcosm in this big picture of pelvic floor health and getting pregnant, pregnancy, postpartum, perimenopause, menopause, all of the things. And that we may know a lot as individuals, but we may be potentially doing a disservice by like overly insisting that this is what's wrong. And, did you do this exercise? And it's more like technical advice. Did you do this exercise? Did you do this modality? Like that sort of thing. And I've been doing a lot of thinking lately as to what it is about, how I work and what I do. And I've said this before, it's not anything new, but it's reiterating it, is that it's not the exercise that I give. It's not the order of the things that I give. It's that there can be, 100 women in front of me and 101 reasons why they got where they were, and probably 102 different pathways for those women to go forward. And yeah, there's going to be similarities and patterns and things like that. But what it comes down to is there can be such different reasons why someone has symptoms. And so that's going to very much dictate what those exercises are, or what that a treatment approach is, or what that modality is. And so that's the sharp-edged sword, part of the sword, for somebody who is just an everyday person who's navigated their own issues, sharing their story, but then kind of insisting on their quote advice, which I think sometimes people, when you haven't been heard by a medical provider, you're going to lean on people that have experienced what you've experienced, almost maybe a little bit too much. And I think it's just an important distinction to make, is like, when you've been let down by the medical field, you're going to go where you feel heard, and just understand that sometimes that's a little bit of a limited view as well. Because you have somebody that may not know why they got there. They don't know why you got there. They're just telling you what happened to them. And so it worked for me, so you too. And we see this, of course, we talked about this before, like we've seen this in pregnancy and postpartum programs. Like women that really were not in this space at all. And then they're like, I had a baby and I did this workout and now I look like, pre-pregnancy, and you can too, follow my program. So there's a lot of different nuances even to that piece. So again, like I think there's such good in sharing our stories. I think there's so much to learn. I think that is a critical part of healing for so many people. I just caution kind of taking, especially if you're the one giving the quote advice, just be wary of kind of the value that someone might place on those words or that story, or did you try this thing, or did you try that thing, because that may not be the best thing for them, but they feel that if somebody recommends it, they should try it. So that's my PSA for the day. But I would love to hear if like somebody told you to do something and you did it and you're like, no, that didn't work at all, like kind of how you felt about that, or even if you've been dismissed in the medical system and like where you turn to get advice. Because again, I can totally believe it. If you think your medical team is full of shit, like why wouldn't you go somewhere else? Like why wouldn't you listen to people that know what you're going through? Because I know I've felt that way too. So I'd be super curious your thoughts.